96.1 to be Atlanta's new home for hip-hop, R&B, and The Breakfast Club. What's up, ATL? I'm Jojo Alonso, and you are chilling with me. I have a special guest in the building with me today, Dr.Bobbi. Yay! Okay, so, Dr.Bobbi, we were in here talking. We were in here just chatting it up because she's also a soror. We just had a Founders Day. Shout out to all my Deltas out there. Okay, hello. So once we got that out the way, we was like, oh yeah, baby, we're gonna talk about any and everything.
Any and everything.
So welcome to Atlanta.
Thank you.
You are you from Brooklyn or you live there?
I've been in Brooklyn since 2003, but I am originally from Newark, New Jersey.
Okay.
But I'm also about to be grounded in Atlanta because I just got a condo down here. So
so you got money.
A little bit.
Well, the money comes from her doing multiple things. One of the things, she is an orthodontist, correct?
Correct.
And an inventor. Big Mouth Toothbrush.
Yes.
It's an electric toothbrush, but where did you get this idea and the name?
So let's bring it back to the idea. So as you said, I'm an orthodontist. For your viewers or listeners that don't know the difference between like a general dentist and orthodontics, I'll just explain it really quickly.
Mm-hmm.
So a general dentist, that's who you go to, you should be going to.
Right.
Twice a year to do your checkups. They do fillings and general dentistry. I became a general dentist, but then I went back to school to become an orthodontist. Took 3 more years. And what orthodontics is it's the study of moving teeth around in your head. Basically, braces, Invisalign, that kind of thing. So in my practice, I have a team of hygienists, the people that clean your teeth. And we noticed that there was a higher prevalence of gingivitis and periodontitis, right? 'Cause
Okay.
I see adults and teens and children. And I always advocated for electronic toothbrushes, as most dentists do.
Yeah, they do.
But the latest advances in electronic toothbrushes were getting smaller and smaller and smaller as the years went on. And I'm like, okay, I like how it looks, but is it practical? How is gingivitis going like this? And these heads are getting smaller. So that's where I came up with the concept of having a wider head on the toothbrush. So it covers more surface area when you're brushing, right? Because when you go to the dentist is like, brush your gums, brush your gums, brush your gums. That's the foundation of your teeth. Brush your gums.
Yeah.
But with these little toothbrush heads and people are brushing like this instead of like this, right? That's why this is a radio. They're brushing horizontal. They're brushing horizontally rather than circular, right? So if you have a small head brushing horizontally, you're not touching your gums. But with this brush, you cannot help but brush your gums as well.
Okay. So when you came up with this idea, you took it to Shark Tank.
I did.
Well, okay, so before we get all into that,
I was gonna say,
because I like Shark Tank.
I love Shark Tank.
Yeah,
It's my favorite show.
So how did you even go about, like, you know
From
what?
concepts.
I want to go on Shark Tank. Like, what was that experience like?
So when I got with this, I came up with the idea of a wider head, right? And I knew I wanted to be an electronic toothbrush. I knew that I wanted to go on Shark Tank before I even finalized my design, before I got the patent.
Okay.
Right? So the patent, when I did Shark Tank, the patent wasn't even issued yet, but I knew I wanted to go on Shark Tank. So Shark Tank is the type of show where you can come on there with an idea. You can come on there with a failed business, right? You can come on there with a business that's already successful. It just all depends on how you formulate your pitch and how it's delivered. For me, having watched Shark Tank for, 14 seasons by that time, I knew that some of the best people that have brands that are brought to Shark Tank, they're most successful with having had some sort of numbers. So I'm like, let me launch my product and have at least a good 6 months of numbers,
right?
And
some kind of revenue,
proof of concept, right? So exactly 6 months. I launched in January of 2022, and then in July of 2022, I applied, and still COVID. They accepted me in August, and I pitched in September. And I can say that it was probably one of the most intimidating experiences
Yeah, I was gonna
of
ask
my
that.
life. Yeah, I mean, I don't scare easily. We know that. I don't scare easily.
I knew that.
You knew that.
Yeah.
So, but I was intimidated. Like I definitely was intimidated. So when I walked into the tank,
Right.
I was like, when I walk in here, I need to make sure that my pitch is on point, right? Because at least if my pitch is on point and I put everything into that pitch, and I can say it effortlessly, and we know about being able to say information effortlessly and
Straight
with
up.
conviction.
Mm-hmm.
And I knew if I did that, then at least they can't take that away from me. So
Right.
even if I did not get a deal, at least my pitch is going to be on point.
Hello.
And it was.
And you gonna respect what I'm saying.
Season 15, episode 14.
Yep. And you got a deal.
I did.
Who was it? Paul?
It was Barbara.
Barbara.
Right. So
I like Barbara.
I love her. She's New York based. She is self-made.
I like
a
Barbara a
self-made
lot.
millionaire.
Mm-hmm.
She is amazing.
Yes.
I wanted to partner with a woman. I did want to, if I had a choice.
Right.
You don't
I
have a
know.
choice,
I get it.
but
I get it.
If I had the choice, I would have wanted to partner with a woman,
Mm-hmm.
either Lori or Barbara.
Yeah.
And it ended up being Barbara.
Yeah. And so so how does that happen? Like once they decide, like what's that process like after that? Like what's the timeline on that?
So I think everyone's experience is different depending
Mm-hmm.
on your product and how it's manufactured and, where you are in your business in terms of being in the beginning, whether it's already established. But for me, I can just literally speak on my experience. So my business was already established. It's something a little bit out of her realm.
Mm-hmm.
But I speak with them every month. I meet with her team, because she's extremely busy and she does everything that she can. But so in the beginning, I was meeting with them like monthly, and I would see her more often. But now I meet with her team, and her team is amazing.
Okay.
And I meet with them like maybe every month or every other month, just to kind of check in and see
seeing
are.
where. Well, that's great.
Yeah.
Yeah.
I love her. I
Okay.
love Barbara.
Yeah, I need to see what these toothbrushes talking about, cause girl, I need to make sure I don't got no gingivitis.
I'll do your exam after. Here, you take that one.
I probably do, guys. I need a root canal. You said you orthodontist. That's what you do too, right? You do root canals.
I
and all
don't, but I hired a general dentist that works for me. And she
Baby
can do
said,
your root
"Oh, I
canal.
don't, but I hired somebody
I'm
to
not
do
doing
it for
none of that no more.
for my business, for my practice. Stop playing with me."
She's amazing.
Well, where did all this begin? Because I'm gonna be honest.
Mm-hmm.
Once I started going to the dentist, because I was bad with I was bad with taking care of my teeth, and then when I decided to start taking care of my teeth, it's really bad. Like my mom did a great job when I got older. I literally just was like, la, 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 la. Like, I brushed my teeth and floss and stuff. But then I'm like, I need to start going to dentist. But then when I started going, like, my teeth were fine. They were good. Mm-hmm. Then I got pregnant.
Yes. I knew you were going to say that. Is it the second
yes.
baby? After the second baby?
Yes. The first or the second. Like, I was told, like, hey, you need to come in and you got a cavity or something. Mm-hmm. And then they were like, get it filled in. But then I was pregnant, so I waited. Then afterwards, it's like, it's turned to a root canal. And I'm like, oh my God. Then I end up pregnant again. And I'm like, oh my God. Now I got to get my wisdom teeth taken out. And
it's like a snowball effect.
Yes. And oh my God, the dentist's office is so expensive.
Ooh-wee.
And I started thinking, I'm like, I think I went into the wrong profession. Like, I should have been a dentist because they make a lot of money. And I know it because I see how much I got to pay.
Because they're needed.
After the insurance is already like took over the majority of the bill. I'm like, oh my gosh.
Yeah, it is. It's definitely very, very serious. But I would say to your audience is that prevention is key because, like you said, had you taken care of that cavity when it was a cavity, you would have only got a filling, right?
Exactly. You won't go through the expensive part.
But then if you leave, and almost all insurances pay for cavities, just so everybody knows, for fillings
to
treat cavities if it's a cavity. So a cavity is a decay process that starts in the crown of your tooth, right? If it stays in the crown of your tooth, you can get a filling. But if the decay travels into your root of your tooth, then you need a filling for your root, which is a root canal. So it's up to you to make sure that you treat it before it even extends into the root. So that's what's really important. That's why I say prevention really is key.
What's a fact about like your teeth that people like really don't know? Like a fun fact.
Okay. So a fun fact. So you spoke about brushing and flossing earlier, right? I am an advocate for flossing. Some people are like, yeah, I brush my teeth twice a day, but do you floss? So many people don't floss. So I try to make this comparison, and I'll leave this with your listeners. If you brush your teeth, you're only brushing two sides of your tooth. So it's like taking a shower without washing under your arms. So can you imagine how your body would smell?
Yeah, you'd be stanky.
If you did not wash under your arms for, say, a week, can you imagine as an adult or even a kid how that would smell?
Yeah, stanky.
So if you don't floss, that's what you're doing. You know?
Okay, is it true that if you have like a decaying tooth, it makes your breath stink?
Yes, 100%. 100%. If you don't floss, it makes your breath stink. If you don't have a tongue scraper, which I have for you later.
Oh, yeah.
Big Mouth has tongue scrapers. I'll give you one.
I seen that, yeah.
Yeah.
Because people usually like brush their their tongue
You
with
can brush
the
your tongue. Mhm.
yeah with the okay. So we say brush twice a day,
And
floss
I say twice a day.
twice a
Every
day.
time you brush, you should floss.
Hmm.
Every
And
time
how do
you
you feel?
brush, you should
So
use a tongue scraper.
okay,
So if you know you already have bad breath and you stick your tongue out and you have a white coating, use a tongue scraper to get the bacteria off.
that's
right?
bacteria.
Yes.
You probably like real grossed out when you look in. Do you get grossed out when you
Not
look into
anymore
people?
because I see it. I see so much.
What's the worst thing you done saw in somebody's mouth?
Oh my God, JoJo, you really want me to answer that?
Yeah.
Is this HIPAA compliant? No, I'm kidding.
Right. You don't gotta tell me who it was.
Right, no,
but...
it's okay. Because y'all, you know who this person was. I'll tell you offline. Okay, so worse. I had to do like a full mouth extraction on a patient that was like 35. And it was, the decay was just like if the person was outside that door and they opened their mouth.
You would have smelt it.
Yeah, see, this is before I got into orthodontist. This is when I was a general dentist. And
You just went.
it just smelled like death. Like, it's like, how are you, and this person was married. So it's like, yeah.
She
that
bought
was-
him. So she
it
bought
was a
the person. She bought this person she bought him to the dentist and said, "No, baby, you go figure this out."
That's exactly what it was.
Ooh, so full
Yeah.
all your teeth, and
Yes.
I can only imagine like I think it's. Have you ever done like root canals and
Yes,
things like
I did
that?
general
Yeah.
dentistry for about maybe 2 years.
Oh,
Like,
okay. And then you were like, I don't want to do that. And then you went to.
went to a residency, went back to school to learn how to do my specialty, and
Oh, okay.
finished, and then here I am.
So you the boss.
Yes.
You run. You tell them what to do.
I have to, but it works. I am the
queen.
best boss ever. I am.
I can
'cause I'm
tell you
so
give great energy.
relatable. I'm so relatable, but anyone who works for me, I train them the same way.
Okay.
Like when we see our patients, you've got to let them know that your overall health care starts with your mouth.
Mm-hmm.
You know what I'm saying? Like, think about that. Everything starts with your mouth.
Yeah.
From whatever coming out of it, whatever's going in it, how you take care of it.
Mm-hmm.
Everything starts with your mouth. And it's really, really important that every time you go to the dentist, they explain that to you and your children when they come in there.
Yeah. Can you explain one more time, like how important it is for people to go to the dentist? Because it is very much slacked. It's slacked.
It really is.
People don't go to the doctor. Okay, cool. But they really don't go to the dentist.
They really don't. And dentists actually screen for like underlying issues, underlying systemic issues. So as dentists, we're trained to screen for oral cancer.
Mm-hmm.
We're trained to take blood pressures, and like even if you don't, your general dentist should be taking your blood pressure. We look for lesions, like the patient that I spoke to you about, where I had to remove all of the teeth. He had underlying issues. Like, one of the first things that I said to him when he came into the office is like, yo, you have to have a physician. I need you to get a note from your physician to make sure you don't have other things going on because
I get what you're saying, because something
periodontal
could.
disease, periodontal disease can lead to stroke. It can lead to heart attack. That bacteria that starts in your mouth can definitely lead to your heart. This is why people that have heart disease have to be pre-medicated before they get deep cleanings. Like, it's a big thing. Like,
I know, that's why I'm like,
serious thing.
That's why I'm asking, because we as a community, we don't know, child. We just la 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 la.
I know they don't know how important it is, but it's so important. It's so important. And I wish I would have bought I have like these little diagrams where I can show you exactly where it goes from the root to the heart. Next time I'll show you. It's very important.
Okay, and then what is your favorite thing about being an orthodontist?
There are a couple things, but what I would say is treating the next generation. So, like, when I was younger, I had, other than my dad, right? I had never seen a black dentist.
I was gonna say that too.
Yeah, I had never seen a black.
Your dad was a dentist.
Yeah, but he was retired before I was even in high school, right?
Okay,
So,
but you
I
followed
went that
his.
route.
You
Yeah,
followed
he
his.
went to Howard. I went to Howard.
I love that.
Yeah.
You
The real
are you a
HU?
daddy's girl?
No.
You not?
No, man.
Oh, okay.
I'm up under
Okay.
my mother. I take care of my mother in and out. She's
Okay,
actually
okay,
my
okay.
office manager, JoJo.
I know that's right. Keep it in the
Listen,
family, baby.
Listen, she's my office manager / you can do whatever you want. So she retired. She was a nurse. That was her profession. And I said, Mom, when you retire, you come to work for me, but you're not really working for me. You can be on my payroll, but you can do whatever you want. You can show up whenever you want, and I'll give you that title, whatever you want to do.
Okay.
But you come in there, you can't tell her she ain't running stuff.
Okay.
She got, what? Exactly. And she bosses everybody around and loves it, doesn't she? She loves it. My sister's in the studio, y'all. She loves it.
I love that for mama.
But my favorite thing, especially when I first opened up my practice, right? I opened it up in East Flatbush.
Mm-hmm.
So very black area, similar to the area where I was raised. And my name on the door says Bobby Peterson. So a lot of people would think I was a white man.
Mm-hmm.
So when they would come in, the parents would come in looking for something, but the kids would come in looking for something else. I loved walking into the consultation room and saying, "Oh, hey," I would start talking to them, whatever, without the formal introduction. I'm like, "Well, when's the doctor coming in?" "Oh, I'm Dr. Bobbi. I'm sorry, I didn't say that." The parents' face would be like, but the little girl's face would be like, and I'm like, "What's up?" Like, get that little connection with them.
Yeah,
like,
exactly. I love that.
I love that. And,
Mm-hmm.
and I took it a step further, JoJo, because that, mentorship and, teenagers are so impressionable at a certain age.
Yeah.
And I wanted them to have a very comfortable experience when they came into my office. So I took it a step further and say in the consultation, they'll say "Oh, I have school pictures next week," or "I just got a new boyfriend." I make a note in the chart so that next time they come, because with the orthodontist, you're seeing them every month.
Right.
They would come in. I'm like, "Oh, what's up with that new boyfriend? You got a picture?"
Mm-hmm.
"Oh, let me see them pictures."
"Oh, you got him off already, girl?"
Yes. Okay. You know what I'm saying? Like, no, they
That's
they
good.
love
That's
that.
important though.
Very.
That's important because we do look for that though. Like when our doctors, dentists, shoot, anybody.
And everybody hates the dentist. So right, they come in there hating us. So it's like, let me soften them up a little bit. Like,
Yeah, that is true.
Y'all
Y'all got a bad rep. Y'all got a bad rep. It is, but it's not bad. It's not bad.
I just try to change it, but it's a lot
I'm
of
glad.
people. I like almost every month I have at least one new patient that comes in at least once a month. That's like, I just hate the dentist. Like, you know what I say? I do too. I hate the dentist too, and that's one of the reasons that I became a dentist.
Straight up, straight up. How do you feel about dentures? Not dentures.
Veneers.
Veneers. Them dentures is crazy. Veneers.
Dentures are necessary for some people.
Yeah, I
They
know
can't
the
do other
dentures part. I'm
things.
talking about the
Yeah.
veneers where they go in and
Shave your teeth down. So
I said dentures because they be looking like them sometimes. My bad, I forgot.
Girl, I get tagged in so many when they first started tagging me and things on TikTok and stuff, I would try to be like very diplomatic about it. Like, well, maybe I don't know what it looked like initially.
Mm-hmm.
So I'm seeing the after effect, but I don't know what it looked like before. In my brain, my dental brain, I'm knowing it ain't no way it looked better than this before.
Are orthodontists doing the
No, I mean I could if I want to. But
so who's
my
doing the
general dentist and cosmetic dentist?
Cosmetic dentist.
And then a lot of people go to Turkey and Colombia and.
So how do you feel about it though? Like, is it something that, like, does it help your teeth? Like, does it? Do those get cavities? Like, how does that work?
Of course they do. So
they do.
So this is what happens. A lot of people go overseas because they have different regulations there.
Mm-hmm.
Just like when women get their bodies done, they have out of the country, they have different regulations there. So in dentistry, there's a certain limit to the amount of enamel we can remove when we're doing a veneer, or like there's a certain regulation in terms of how much fat can be removed, because there's certain things that you want to remain healthy. Like that's why they have these standards in America, right? Mm-hmm. But overseas, the regulations are different. So I can tell you tons of people that you probably know that have come to my office and they went to these countries, and as soon as they come back, because they're not there for months and months and years, they come back and 2 months later they're falling off. And then it's like they're falling off because there are different regulations with the amount of enamel that can be removed. There's different regulations with the materials that can be used, right? So they're using anything that looks good at the time. Not all of them. I'm not saying all of them.
But most of them, because I be seeing them.
A lot of them. A lot of them. So so the worst that I've seen are people that have a lot of spaces between their teeth, right? Mm. So this is something that your viewers really need to pay attention to. If you have a lot of spaces between your teeth and you go to get veneers, one thing you need to think about is the tooth structure that they're adding to your teeth. It has to fill the spaces. So it's making your teeth look probably twice the size that they are. And that's where you get these little chiclet teeth, right? So like just kind of or if your teeth are crowded, right? And you get veneers, there's only but so much space they can use. So those are the skinny little veneers that you see. So
is there like a process you can do? Like, what is it that you can do to just get your teeth white? Because I want my teeth white. I don't want, I think I have beautiful teeth.
Nice teeth. I've seen them already. I've already done my exam already.
Before I go in, make sure she
Look, like
good.
that's
Before I got-
$200 right there. No, okay.
But I want them white. I want a veneer white.
Okay,
So like, is there any other?
Well, let's do a consultation right now.
Okay.
All right, you're in my chair.
I'm scared.
No, I'm not going to
Okay.
look in your mouth. I'm just going to talk to you, right? So you're in my consultation. Hey, JoJo.
Hey, girl.
How you doing?
Look at my teeth.
Okay. The first thing I would ask you is about your oral care. So I would say, okay, do you see your dentist every 6 months?
Yes.
Okay. What's your at-home whitening routine? Have you used any over-the-counter products yet?
No.
Whitening strips, nothing?
No, just Sensodyne whitening toothpaste.
Okay. How does that make your teeth feel after you use it for a couple weeks?
Smooth.
Okay. Does it whiten your teeth?
No.
Okay. When you drink something cold, does it bother your teeth?
No.
Okay. So that alone, those answers that you just gave me, will let me know that you are a candidate or a possible candidate for in-chair bleaching. Right? So those of your listeners that have tried all of these over-the-counter things and they haven't really worked, but they have not made their teeth sensitive, to me that means that you possibly could have some healthy enamel so we can go to the next step, right? So in my office, we do whitening, of course. We have to. Every dental office has to do whitening. But we have 3 different stages, 3 different levels of intensity of our whitening. So if you came in and you said you did have sensitivity to cold, we would start you on the lower level. Shine the light for 10 minutes. If it didn't bother you, we turned it up. I will start you in the middle, right? Put the middle level of intensity on you. Shine the light for 10 minutes. If it doesn't bother your teeth, we turn it up to the highest.
Mm-hmm.
If it does bother your teeth, we put it on the lowest. The idea is that we want to whiten your teeth as much as possible without damaging your enamel.
Right.
So that's why we have those intensities. Every office doesn't do that, but I'm just telling you what my office does.
Okay.
Yeah.
And then I can try to do like some over-the-counter kind of situations, or you would prefer just
off camera.
We'll talk about it.
I'll tell you what I would recommend. The reason why I say off camera is because they don't pay me.
Yeah, I know.
So,
I was gonna tell you not to say it anyway.
Okay.
Yeah, no.
I have a nice
I ain't
little
saying
regimen.
nothing to anybody.
I have a nice regimen
You
that
better.
you could try first.
You better. Okay, so we'll talk about
Yeah,
that. We'll talk about that.
definitely.
Well, then let's see. Where can people get Big Mouth?
So the Big Mouth Toothbrush. Okay, so when I went on Shark Tank, it was electronic, right?
Okay.
Now it's sonic. So the difference between an electronic toothbrush and a sonic toothbrush is the amount of vibrations. So it used to be 9,000 per minute, right? And now we got a whole sound bath.
I know that's
This
right.
is 50,000 per minute. You hear that song? And there are 5 different. Yep. 5 different intensities. So you have,
Clean, white, polish, massage, sensitive. All
yes.
right.
So just to give you a little background, the intensity for let's say the whitening, that's one of the most intense vibrations. If you are a smoker or you drink a lot of coffee, you might want to use that to get rid of the staining because it's
Okay.
very, and then there's a 2-minute timer on it as well. So,
Oh.
you're supposed to brush your teeth for 2 minutes, right?
No.
Yes. And most people don't.
Yeah, I'm probably like 45
45
seconds.
Right. 'Cause
That
everybody-
seemed like a long time.
It actually does. It actually does.
2 minutes?
Yes.
Okay, 2 minutes.
So-
I'll take 2 minutes out to
It's
brush my teeth.
you have to,
Like,
but
I'm capped for that. Like, why I wasn't doing that at first.
It's good for my. But what I do for my morning routine is I'll put my my little turmeric pads on for my soap. It has to sit for a second, and that's 2 minutes, right? So brush for 2 minutes. By the time
Okay.
that's done, rinse your face. Boom. Or you can even bring this in the shower with you. Like
Yeah, that's
it's
what I-
shower proof.
Okay, yeah, that's what I probably would do. So, what's the website?
Oh, www.bigmouthtoothbrush.com.
Period.
Yes, for those of you that do not like sonic toothbrushes, we have
Oh.
manual toothbrushes.
Great.
I don't know if I told you, but I'm like the youngest of 8, so I have a lot of siblings.
Oh,
right?
I have 10. Yeah, girl, it's a bunch of us. I'm the baby girl.
I am too.
Yay, we love each other.
Oh, my gosh, so
Next
you
thing you gonna
feel
tell me
me.
your birthday is on my birthday. Please don't say
August?
that. Okay. Whew, no.
Okay, what is it?
Christmas Day.
Oh no. Okay. So happy belated.
Thank you. Yeah, we okay, cool, great.
So then you know how the bathrooms are. When you have a bunch of siblings,
Oh,
and
yeah.
you have your toothbrush in there. You know how the toothbrushes used to touch.
Yes.
So this is why I made a manual toothbrush that stands by itself, and it still has the customized cap. That's
Oh.
another thing. The cap that you have on your toothbrush, you should always have a cap on your toothbrush. It should be airated.
Oh.
Because you know that when you brush your
yeah,
teeth, it's wet.
it'll get trapped and
you don't want the-
moisture.
yes, and you don't
you
want
probably
the-
got mildew now.
Yes, and then the germs from your toothbrush.
Yeah.
I'm sorry, your toilet bowl. When you flush the tooth,
Oh.
it's all over the bathroom. All over the bathroom.
You was helping
All
me out
getting on
now.
your toothbrush head.
See, get me together. Get me together.
Cover it up. And
Cover
it stands
it
by
up.
itself, so it's no.
Yuck. Okay. Great.
Same thing with these. You want to make sure that they're individually wrapped.
What's that?
Oh, these are floss picks. I'm sorry. Here.
Oh, you got floss picks too?
I have the
Go
floss picks.
ahead.
They're individually wrapped.
Yeah.
And the reason I did that is because, during COVID, everybody became well aware of just hygiene and wash your hands, keep everything separate.
Mm-hmm.
So I came up with individually wrapped floss picks. So
Yeah, I like that
they're
idea.
Very, very, very strong. You can grab a bunch. They're a hit at dinner parties.
Mm-hmm.
You grab a bunch, put them in your bag.
Okay.
Yep. And give them out when everybody's going like this with their teeth.
Mm-hmm.
Be like, no, girl, I got something.
I got you here.
Yeah, here you go. Take that.
Yeah, and matter of fact, order you some. Where you at it?
Why you at it? It's right on
Oh,
the
you
back.
gotta order
It's
some.
right on the back.
Right here. Stop playing with me. I appreciate you coming and chatting with me.
Yes.
This was fun. I knew that this was gonna be fun. I'm like, oh yeah, and I love talking to my queens, especially when they got their own, business and they out here flourishing. So I appreciate that. And drop your social media handle though, so they can also follow you and keep up with everything you have going on.
Yes. So it's I am Dr.Bobbi. I am Dr.Bobbi. I am Dr.Bobbi on Instagram. The Big Mouth Toothbrush on Instagram. All things Dr.Bobbi on Instagram. And Dr.Bobbilicious on TikTok.
I know that's right. So what's next? What do you want to do next?
Okay. So there's so many things. But right now, you can get Big Mouth Toothbrush and Big Mouth products on Amazon. They're being sold in over 200 dental offices.
I love that.
Yes. And then also direct to consumer, which we always, know is the best. I think for me, I'm looking for like product placements and things like that. There's a show called Survival of the Thickest. Like they just had it on there. Like, people are doing more of that. But I want to slow down. So I have a practice in Brooklyn and I have one in Philly. I want to slow it down and just kind of put more into Big Mouth.
Okay.
Just making Big Mouth a household name. I'm not into the retail too much because I don't know if your listeners know, but retail takes a lot of money from you. So I'm like, I'm doing well the way I'm doing, the way I'm going right now, and I just want to, just make it a household name. I want to get it to Tyler Perry now. I need Oprah to get it.
Yeah.
You know what I'm saying? Beyonce already has it.
Oh.
I need to get it in Missy. Love her.
Yeah, we'll figure something out. It's gonna happen.
Yeah, I mean
Anyway.
that's the next step for me.
Yeah.
It's an amazing toothbrush. Everyone that tries it, and I promise you're gonna say the same thing.
I'm excited.
Yes, you will not use.
When I
another
seen it, I
toothbrush.
said, I can't wait.
And you have a 9-year-old. This is kid friendly. The
Yes.
manual is kid friendly.
Yes. Crazy thing. She actually for Christmas on her Christmas list, she had a really big toothbrush on there that she wanted for Christmas, and I couldn't find one.
Shut up, girl. Look at God.
Yeah.
Yeah.
So, but here we are, period. But again, thank you so much for coming and joining me today.
This was a lot of fun.
ATL has been fun. But we about to go ahead. We about to go stroll. So we'll catch y'all later. See ya.
Let's do it. Look.
Right, exactly. We're gonna go move these folks out the way.